Welcome to Ollie's Anatomy and Physiology Practice Review live stream. Today we're going over some medical terminology for anatomy and physiology. How's everyone doing? I hope you're doing well. I hope you guys are having a great weekend. I hope you guys had a great Friday night. I hope you guys have some fun and restful plans for the weekend. We're going to do some medical terminology for anatomy and physiology and pharmacology. Hello, everybody that's just joining us. Welcome in. Appreciate it if you guys gave the live stream a like. It just helps to get it out to more people, so we can help as many people as possible learn this information for anatomy and physiology. Whoever has A&P coming up in the fall, and then pharmacology as well. We have about 25 questions for anatomy and physiology, and then we have 25 questions for pharmacology. They're all medical terminology based. We're already at 100 likes already. Thanks, guys. I appreciate it. Welcome in, everybody that's joining. We'll get started here in just a moment. I'm going to let a few more people join, and then we'll go ahead and get started with number one. Awesome. Welcome in, everybody. Welcome to Ollie's Anatomy and Physiology Practice Review live stream, where we make anatomy and physiology finally make sense for you. Hi, Chikorita80. Hi, Leslie. Hi. Hi. Hello, everybody. Welcome. Happy weekend. How are you guys doing? We're going to start now. Welcome to the live stream. I go live multiple times a week, covering A&P topics that you guys request. We do some pharmacology on here as well. We're almost at 400 likes already, guys. Thank you guys so much. We'll go ahead and get started now with number one. Which term refers to the study of tissues? Zito said, "Hey, Ellie, I'm early." Welcome in. I'm glad you're early. Welcome. Early bird gets the worm, as they always say. Norma said, "Yay, I found you." Awesome. Welcome. Good to see you, Norma. Zito said, "I take my teas on Monday." Oh my goodness. Good luck on your teas. If we're going to get a good luck in the chat for Zito, that'd be fantastic. Awesome. Number one, I'll give you guys one more second to answer. We're at 500 likes already, guys. Over 100 of you in here now. Welcome into the live stream, everybody. The answer is going to be C here. This is going to be histology. So what term refers to the study of tissues? That is histology. Cytology is the study of cells. Pathology is the study of diseases. Physiology, as you know in anatomy and physiology, this is how the body functions, or the processes of the body. Number two, what is the prefix hypo most accurately defined as? A, B, C, or D? A, B, C, or D? Well, welcome in, everybody. Hold on one second. I just had a notification from the TikTok thing. But we're on number two now if you're just joining. If you are just joining, welcome to Ollie's Anatomy and Physiology Practice Review live stream. We go live here on TikTok multiple times a week, covering anatomy and physiology, as well as some other topics. Where do you get these study sheets? Let me post them up here. Give me 1 second. I gotta hit the button. So I have a new stand right now, and it's not the best. It's not the most functional one. This is the one I travel with. You just joined the community here on TikTok. I just put up the little notification. Once you join, you can send me a message once you join. Let me know. And then you'll get the blank test with the answer key at the end after every live stream. Number two, what is the prefix hypo most accurately defined as? The answer is B. It is under or below. If you think of the hypodermis, this is under the dermis, and then above is the epidermis. Over would be hyper, equal would be iso, and between would be inter. Alrighty? Perfect. Number three, what does this refer to? What does this terminology refer to? This is the kind of massive learning I like. Perfect! I'm so glad. Thank you. I'm so glad. Awesome. You guys are fantastic. We're almost at 1.5 thousand likes on the live stream already, guys. You guys are crushing it. Number three, the answer is A. It is the liver. Hepat means, this actually comes from the word hepar, which in Greek means liver. Heart is cardi. Kidney would start with stomach would be gastro. All right. Number four, the suffix itis indicates what? A, B, C, or D? The suffix itis indicates what? A, B, C, or D? Oh, Vixen said, I just passed anatomy and physiology yesterday with an A. Oh my gosh, congratulations. If we get a congratulations in the chat for Vixen, that would be fantastic. Congratulations, that's awesome. Questions like this on the T's. So this is mostly just for like medical terminology for anatomy and physiology and like pharmacology eventually here. So these questions, they will be similar to they're kind of on the same concepts, but I did not make these questions today with the HESI or T's in mind. That'll be Monday and Tuesday. Number 4, the answer is D. It's inflammation. Itis means inflammation. So if you think of pancreatitis, that would be inflammation of your pancreas. Or if we refer to this, if we use this, we have hepatitis is inflammation of the liver. Number 5, the medical term for red blood cell is what? While you guys are answering that one, tumor would be oma. Cutting into would be anatomy. Disease is really just like a pathology or some sort of general term. Number 5, the medical term for red blood cell is what? A, B, C, or D? Thank you guys for putting congratulations in the chat as well. What time? They should be at 3:30 p.m. Eastern Standard Time both days. I will put out a schedule for that. It should be linked in my profile. The answer is C. It is an erythrocyte. Erythrocytes are, erythro means, let me break this word down for you. So you have erythro, which means red. Cyte means cell. Leukocyte is a white blood cell. Thrombocyte is a platelet. And melanocyte is that pigment skin that releases melanin. All right. Moving on to the next page of questions. You can also rewatch this on YouTube. It's linked in my TikTok bio. Number 6, which term refers to the position lying face down? And if you are just joining us and you're new here, welcome to Ollie's Anatomy and Physiology Practice Review live streams. We're going over some medical terminology for A&P and some pharmacology medical terminology as well. This is the live stream. We go live multiple times a week, making all these terms, all these concepts finally make sense for you all. But welcome in, everybody. I took my T's and Pass starting my nursing program on the 21st. Congratulations. That's awesome. Let's go. Congratulations. If we could get congratulations in the chat as well, that would be fantastic. Number 6, the answer is B. It is prone. Prone is lying face down. Supine is lying face up. Anterior would be the front, and lateral would be toward the side. All right, moving on to the next page here. Number 7, the root word derm refers to what? A, B, C, or D for this one. Also, all of my anatomy and physiology study guides are available on my website, linked in my TikTok bio. I also just recently released a study guide for the A&P section for the HESI and T's. That is also on my website. Number 7, the root word derm is going to refer to the skin. So derm means skin as in dermatology. Muscle would be myo, brain, could be encephalo, and then joint is normally arth. So you have like arthritis. Number 8, ectomy means what? A, B, C, or D? A, B, C, or D for ectomy. For ectomy, what do you guys think for this one? Be cool if you could print these out ahead of time and do them with you. Yeah, we do it real time here, and then you can, I give these out at the end of live streams as well. If you join the community here on TikTok, we'll actually put up the thing here. Once you, this is how you can get them. You get the blank test and the answer key at the end, then you can do it by yourself. Or if you want to rewatch, it'll be on YouTube. But if you want the blank thing that you can print out and do on your own, that's how you get it. Once you join that, just let me know. Just send me a message or an email, and then you'll get the blank test and the answer key after every single live stream. I go live at least 4 times. I try to go live every day, but I go live at least 4 times a week. So you'll be getting at least 4 tests a week, about 16 a month. The answer is going to be C for number 8. Ectomy is going to refer to a surgical removal, whether it be an incision or whatnot. This is normally logy for the study of. Condition of is, or osis. Pain normally is this. Number 9, which plane divides the body into right and left halves? A, B, C, or D? A, B, C, or D? I know that's from getting my gallbladder removed. Oh my goodness. Oh my goodness, there's over like 700 of you in here now. Welcome everybody. Welcome. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. We go live multiple times a week covering anatomy and physiology and some other topics you guys request. Today we are focused on medical terminology for both anatomy and physiology and pharmacology. The pharmacology will come at the end. We're on number 9 now if you're following along. Number 9 is D. It's sagittal. The plane that divides the body into right and left halves. The way that I always kind of remember this, it's a little bit silly, but think of like when you sit on a horse. You sit on a horse with your you sit on them with a saddle. It kind of sounds like sagittal, saddle. And then when you sit on a horse, it's kind of like in a way your right and left leg go to the sides, and it's in a way it like kind of divides your body. Number 10. Which prefix means fast? Which prefix means fast? A, B, C, or D? A, B, C, or D for this one. Welcome everybody. Welcome. Thank you guys so much for being here. Thank you guys. You guys are absolutely fantastic. The transverse plane would separate it from top and bottom. Coronal frontal would be front or back. And then obviously the coronal and frontal are the same thing. Number 10, it is going to be tachy. So if you have tachycardia, your heart rate is very fast. Brady means slow. The way I was kind of thinking this means slow. If you're a fan of football, I always thought of Tom Brady for this because he's not obviously he's a great football player, he's the GOAT, right? But he's very slow, not a very fast runner. This means abnormal or potentially painful. Hyper means excessive, not necessarily fast. This just means excessive. I know a lot of students get tachy and hyper mixed up. Number 11, we're going to move on to the next page now. At number 11, what is the term for the muscle that decreases the angle at a joint? What is the term for a muscle that decreases the angle at the joint? A, B, C, or D for this one. What do you guys think? I'm also going to read some of your comments as well. This is just some medical terminology review. I know a lot of students are starting some classes come the fall, and I always recommend going through medical terminology to start as a way to prepare for your fall or spring semester or whatever it may be. Thank you guys so much for all the follows as well. Thank you guys for 6,000 likes on the live already as well. Number 11, moving on down to the full next page here. It is flexor. Flexor is going to bend a joint, decreasing the angle. Extensor is going to increase the angle. Adductor is going to move the limb toward the body. Rotator is just going to rotate. Cardiomegaly refers to what? A, B, C, or D? What do you guys think for this one? A, B, C, or D for cardiomegaly? A, B, C, or D? I'm in a midterm class right now. That's awesome. I start this August. I'm so glad you popped up. That's awesome. Yes, no, we'll definitely be going live in the fall and everything as well. We'll be doing some medical terminology, pharmacology, anatomy and physiology. Mostly anatomy and physiology, but we do sprinkle in other topics. All right, the answer is B. It is enlarged heart. Cardio means heart. Megaly means enlarged. Heart failure, that would be like CHF. Regular heartbeat, there's an arrhythmia. Heart pain would be cardiac or angina. That's like normally chest pain. So chest pain, heart pain can be referred to the same thing. Nephrology would be the study of what? We kind of went over what nephra means. But what do you guys think for this one? A, B, C, or D? A, B, C, or D. Thank you, Carson, for the rose. Thank you guys so much for the gifts. I appreciate it. We're almost at 7,000 likes on the live stream today. You guys are absolutely crushing it. The answer is going to be D. It's going to be the kidneys. Nephrology is the study of the kidneys. Liver would be hepatology. Stomach is gastrology. Nerves are neurology. Number 14, which combining form means lung? A, B, C, or D for this one? Which combining form would refer to lung? Yeah, medical terminology is kind of easy if you study Latin and Greek in high school. Yes, it definitely is. Yeah, for sure. Everyone, yeah, if you have a strong background in Latin or Greek, you would definitely do okay. That's why anatomy and physiology can sometimes get a little hard. I took medical terminology at the same time as I took anatomy, and it really helped. But in a sense, like, you're trying to learn new concepts and information and a mass amount of information, while also in a sense like trying to learn a new language as well. So it's, that's kind of why it's a little tricky for some people sometimes. Number 14, the answer is C. Think of pulmonary. This would be lung. This would be the kidney. This would be the liver, and then stomach. Number 15, what is the meaning of arthroplasty? A, B, C, or D? Welcome, we're almost at 500. We're almost at 500 people now. So this is kind of just review for a lot of people who are starting these classes upcoming in the fall. This is for people who pretty much I've been getting a lot of questions of how they should prepare, and I always think that you should prepare by studying medical terminology ahead of time. For anatomy and physiology, I think in person is the best. Medical terminology, that's more so. I think the best way to learn is by flashcards, so that one can be kind of done online. But anatomy and physiology is definitely better in person, but if you have to take it online, that works too. Number 15, the answer is a surgical repair of a joint. Arthro means joint, plasty means surgical repair. So let's break these words down. This is going to mean joint, and this means surgical repair. Joint swelling, this would be edema. Joint pain, inflammation, itis. So these words plus, it would be arthro plus these words if it was the other one. Moving on to the next page of questions here, everybody. Number 16, cyanosis refers to which condition, A, B, C, or D? Thank you guys so much for the follows as well. Welcome into the live. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. We go live multiple times a week, covering anatomy and physiology topics, as well as some other topics as well, like pharmacology, biology, chemistry, etc. But welcome in. It's nice to meet you. My name is Ollie. We're pretty much preparing for anatomy and physiology and pharmacology. Some people have A&P classes coming up. Some people have pharmacology classes coming up. So we're just kind of preparing, going through. The biggest recommendation I have to prepare for those things, because you don't need to really do too much preparation ahead of time. But I think medical terminology and just the terminology of both subjects are the best way to prepare for a class. Number 16, the answer is B. It is bluish discoloration. Think of Bluey, the little cartoon. Cyan means blue. Osis means condition. Yellowing of the skin, this would be jaundice. Excessive bleeding is referred to as a hemorrhage. Lack of oxygen is hypoxia. Though cyanosis is actually caused by hypoxia. So this... Let me write a little arrow here. Causes. Number 17, which root word means blood? A, B, C, or D? A, B, C, or D? We're at 8.6 thousand likes on the live today as well. You guys are absolutely crushing the like button. I appreciate you all. Thank you guys so much for being here as well. Thank you for the follows as well. We're at number 17 now. If you're still following along, which root word means blood? The answer is D, mostly referring to hemo. So this is our blood. Gastro is our stomach again. Osteo actually means bone. This is a new one that we haven't covered today. Nephro means kidney. Number 18, osteoporosis most accurately means what? A, B, C, or D? So what? We just went over what osteo was. That means bone. So osteoporosis would mean what? A, B, C, or D? A, B, C. We did 10,000 likes. I just looked away for a second to answer the question. What exam are we studying for? We're not necessarily studying for any exam today. We're not studying for an exam. We're just kind of prepping. We're just we're reviewing some medical terminology that you'll see in anatomy and physiology and pharmacology. So no exact exam today. But if you do have an exam that you want to see questions I make for, send me a message. And this you can send me a direct message and request topics. I'm happy to put those in here. The answer is B. It is porous bones. Osteo, again, means bone. Porosis is going to be a porous condition. So the bones necessarily, they don't... Let me spell that wrong. Oops. So you have a loss of your bone density, so they're a lot more porous, less structurally sound. So... Again, osteoporosis means porous bones. Number 19, which suffix means record or picture? Record or picture, A, B, C, or D for this one? A, B, C, or D? What do you guys think? There's over 900 of you in here now. Welcome, everybody. Thank you, guys. We're at 13.2 thousand likes. We're on number 819 if you're just joining us. Hi, welcome to Ollie's Anatomy and Physiology Practice Review live stream. I'm Ollie. Number 19, the answer is C. It's gram. Gram means to record or image. Think of like a cardiogram. Ology is the study of. Would be cutting. Emia, would be a blood condition. The prefix Brady means what? A, B, C, or D? The prefix Brady means what? I kind of went over this a little bit earlier, but let's see what you guys think. I have a little funny way of kind of remembering it too. I'll let you guys answer that. But welcome. My name is Ollie. I just got my master's degree in molecular medicine, and I've also been a tutor for anatomy and physiology for about 5 years now. But welcome, everybody. This term is going to mean slow. The way I was thinking about it is, I don't know if you do know football, there's Tom Brady. He is the GOAT, right? But he is a very slow runner. That's how I always kind of remember that. Fast was tacky. Above normally means, it depends what it means, but normally like above a certain level would be hyper or excessive, or sometimes above it can be epi. Pain just refers what you're, like epidermis is above the dermis. Moving on to number 21. Number 21, what does gastralgia mean? A, B, C, or D? What do you guys think for this one? Welcome, everybody. It's so glad that you're here. Welcome. There's a class. There was a kid in my class, so I always thought of the opposite of him. Oh, that's awesome. But welcome, everybody. Welcome. I also have my notes for anatomy and physiology, and I have a study guide for the HESI and T's A and P section on my website, as linked in my TikTok bio. Probably answered that with pain. I know, I definitely did. But hopefully that means you're paying attention, which is a good thing. So the answer is going to be A. It's going to be stomach pain. Inflammation would be gastritis. Surgical removal would be a gastrectomy. Tumor would be a gastroma. Number 22, cerebrovascular relates to what? A, B, C, or D? For this one, A, B, C, or D? We're almost 1,000 people in here. Oh my goodness, thank you guys so much for being here. It's nice to meet you all. Yep, can we explain Brady for you? So if you think Brady means slow, so the biggest example of this is bradycardia, where your heart rate is too slow. I always think of Tom Brady. He's a football player. He's not very fast, but he's a good football player. So that's how I always kind of remember that one. So it's a slow heart rate. Tachycardia is the opposite. It's heart rate that's too fast. Number 22, the answer is B. It is the brain and the blood vessels. So cerebro means brain. Vascular means blood vessels. Number 23, the term hyperglycemia refers to what? We just went over what the term hyper meant, and then we haven't talked about the next word here. So let's see what you guys think for this one. What do you guys think for this one? We're at 17.7 thousand likes in the live today, guys. That's awesome. You guys are awesome. What am I writing on? I'm writing on a 12.9-inch second generation iPad. That's what I've been using for like 7 years now, I think. Something like that. 7 years? Something like that. Time has gone by very fast. Number 23, the answer is C. It is high blood sugar. High blood sugar. Remember that hyper means excessive. Glyce means sugar. And emia is going to refer to a blood condition. So we have excessive sugar, blood condition, so high blood sugar. Low blood pressure would be hypotension. Low blood sugar, remember low was hypo, so it'd be hypoglycemia. High blood pressure would be hypertension. Number 24, what term means difficulty swallowing? A, B, C, or D for this one? What do you guys think? Thank you guys so much for the follows as well. If you're just joining us, welcome to Ollie's Anatomy and Physiology Practice Review live stream. We go live multiple times a week covering anatomy and physiology, as well as many other topics that you guys do request as well. I appreciate you guys being here on a Saturday. We're at 1,000 people today, guys. That is insane. Oh my goodness. Hello, everybody. Welcome. It's nice to meet you all. We're at 20,000 likes too. My name is Ollie, by the way, everybody. Number 24, the answer is B. This is dysphagia. So this is going to refer, so DYS refers to difficulty. Dysphagia means swallowing. Dysphagia means difficulty speaking. I think I put the same thing for these two. Dysplasia. Sorry, my dyslexia was kidding. Dysplasia means means abnormal growth. Yeah, this is difficulty breathing for D. Sorry, my dyslexia kicked in. I missed the H versus L. Number 25, the root word myo is going to refer to what? A, B, C, or D? What do you guys think for this one? If you are new here, welcome to my live stream. Welcome to Ollie's Anatomy and Physiology live stream. We go live multiple times a week covering anatomy and physiology topics. Today we are focused on medical terminology for anatomy and physiology and pharmacology. I take topic requests as well. Also, if you would like to get the blank test to do on your own, it has the answer key at the end. You just join the community here on TikTok as well. Just hit that. Once you have joined, just send me a message or email letting me know your username, and then you will get the blank test and answer key at the end of every live stream. I also have my notes for anatomy and physiology on my website linked in my TikTok bio, and I also just released a study guide for the A&P section of the HESI and Ts that is also linked in my TikTok bio. Number 25, the answer is muscle. Think of, so myo means muscle. So think of the myocardium. This would be muscle of the heart. Bone is osteo. Marrow would actually be maleo. And then blood is hemo. Number 26, we're going to move on to some pharmacology now, guys. Some pharm term. Let's see what you guys can get for this one. Some pharm term coming up. The term analgesic refers to a drug that what? A, B, C, or D. You can also watch the replay of these on YouTube. That is linked in my TikTok bio. But real quick, I will write my YouTube in here for you all as well. But welcome, everybody. We're going to move on. Thank you for the sub. Thank you for the sub. Please send me a message so you can get the questions after the live stream today. Recology, thank you so much. Thank you guys so much for being here. We're almost at 25,000 likes on today's live stream already, guys. That's absolutely fantastic. The answer for number 26 is going to be C. It relieves pain. So the root word here, AN, is going to refer without, and analgesic is going to refer to pain, so without pain. Number 27, what does the prefix anti mean in pharmacology? A, B, C, or D? What does the prefix anti mean in pharmacology? A, B, C, or D? Taking the T's in 12 minutes. Thank you. Good luck on your T's, Kaylee. If we get good luck in the chat as well, that would be fantastic. And if you are joining us today, we are reviewing some medical terminology for anatomy and physiology and pharmacology today. A lot of students have letting me know that they're taking A&P in the fall, as well as pharmacology, and everyone keeps asking me, what is the best way to prepare? The best way to prepare, in my opinion, is to really hammer down your medical terminology. Number 27, the answer is A. It is against. Anti means opposing or acting against something, so an antibiotic would be against life, which would be bacteria in that case. Fast, we went over earlier, is tacky. With would be C-O-N, sometimes C-O-M. Toward would be add. Number 28, a drug that ends in frill is likely a what? What medication would this likely be? A, B, C, or D? What do you guys think for this one? Thank you guys so much for the follows as well. It's nice to see some new people in here. I always try to remember people's names, especially if you are a frequent viewer in the live stream and everything as well. Thank you guys so much. Thank you, Stephanie, for the gift. Thank you guys for the gifts. Thank you guys so much for being here. Thank you for, there's 1,000 of you in here now. That is absolutely insane to me. Thank you all so much for being here. I go live multiple times a week covering anatomy and physiology topics, as well as some other topics as well. Number 28, the answer is A. It's an ACE inhibitor. Classic example is lisinopril, enalapril. These are going to block. So ACE means angiotensin converting enzyme, so it was going to inhibit angiotensin converting enzyme. Beta blocker would end in a low. Antibiotic, they have various endings most of the time, and then diuretic has ide. Again, an example of this would be furosemide. I was also a pharmacy tech for 4.5 years, so I don't know if there's any pharmacy techs present today, but please let me know if you're a pharmacy tech. Number 29, what is the study of how drugs move throughout the body? What is the study of how drugs move throughout the body? A, B, C, or D? We do topics on pharmacology, anatomy, biology, chemistry, etc., all those sorts of things. I went to school for pharm a little. That's awesome. I was a pharmacy tech, now an MA and nursing student. That's awesome. Pharmacy techs and pharmacists definitely have it rough. I know the grind. It's definitely a rough grind. It got me through school. I used it to pay for my school. So, what the grind? It was quite the grind. The answer is B. It is pharmacokinetics. Pharmacokinetics. This focuses on absorption, distribution, metabolism, and excretion. Pharmacodynamics is what the drug does to the body. So drug effect on body. Pharmacokinetics is how it moves through the body. Toxicology is the study of poisons, and pathology is the study of diseases. Number 30, what does OTC stand for? A, B, C, or D for this one. What does OTC stand for? A, B, C, or D? What do you guys think for this one for number 30? Number 30, what do you guys think? I just got my PTCB certification last week. Awesome, congratulations, Ben Varika. The congratulations in the chat was for your pharmacy tech for 16 years. That's insane. Yes, it was not easy. It is not an easy job. Number 30, the answer is A. It is over the counter. It is over the counter. So over the counter means that you do not need a prescription for this drug. Oral treatment is not really not really a term. Oxygen therapy compound, unrelated, and then outpatient treatment care, that's just not related there, not a term. Number 31, what does subcutaneous mean? A, B, C, or D? What does subcutaneous mean? A, B, C, or D for this one. Welcome in everybody that's just joining. Also, as we move on to the next page, you can rewatch every live stream that I go through on YouTube. It's linked in my TikTok bio. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. We go live multiple times a week covering A&D topics and other topics that you guys do request as well. Number 31, what does subcutaneous mean? This is under the skin. Sub, meaning under. Cutaneous, referring to the skin. So under skin. Into the muscle would be intramuscular. Into the vein would be intravenous. Into the skin is intradermal. So this is one that students often get mixed up quite a bit. All right. Number 32, a drug that causes urination is known as a what? A, B, C, or D? What do you guys think for this one? A, B, C, or D? Also, if I miss a question or anything, chemistry here, Zoe, chemistry teacher here, loving the refresh. That's awesome. Thank you for being here. Thank you for being here for your refresher. I appreciate that. A, B, C, or D? Graduated college in 2017. She's still fresh in my mind. That's perfect. That's awesome. No, that is a very good thing. Number 32, a diuretic. Diuretics increase urine production. So they increase urine production to reduce fluid volume. Antihistamine is going to reduce allergic symptoms. Antipyretic, this reduces fever. Sedative is a calming effect or a sleep-inducing effect. Number 33, I just kind of gave that one away. Number 33, antipyretic medications are used to what? A, B, C, or D? A, B, C, or D. I'll give you guys like a second because I accidentally just gave that away. That's why it's very important. That's one of my test taking tips. Go through the answer choices and see which ones are wrong and which ones are right. Because sometimes it gives it away later on. I do that sometimes. But the answer is C. It is to reduce fever. Anti means against, as we mentioned earlier. Pyretic means fever. So it is going to work against a fever to reduce fever. Number 34, a broad-spectrum antibiotic is effective against what? A, B, C, or D? A broad-spectrum antibiotic is effective against what? And then if you can give me the reason, bonus points on that one. We're almost at 30,000 likes in a live stream. Again, we're here if you're just joining us. We are reviewing. A lot of students have been saying that they have anatomy and physiology coming up in the fall, pharmacology coming up in the fall. And a lot of people have been asking, how do you prepare for it? The best way to prepare is to hammer down your terminology. The answer is A, many types of bacteria And when we're referring to many types of bacteria, we're really referring to what is referred to as gram-positive and gram-negative. All right, just like we mentioned here. Fungi would be antifungals. Number 35, the loading dose of a drug is what? A, B, C, or D. The loading dose of a drug is what? A, B, C, or D. What level of academia are these questions? These are most, I would say, like pre-undergrad level. This is kind of like a preparation to get you ready for an undergraduate level course. I'm just a random dude learning because it's enjoyable. Awesome, trademark. Welcome. I appreciate you. I appreciate you being here. How often do I go live? I try to go live every day, but I go live at least 4 times a week. Thank you so much for the shares, guys. Thank you for sharing the live. I appreciate it. Number 35, the answer is B. It is the initial higher dose. So the loading dose is given to quickly reach a therapeutic level. Dose given over time is a maintenance dose. Smallest effective dose is the minimal. Toxic dose is too high, it's too harmful. Number 36, bioavailability refers to what? Bioavailability refers to what? A, B, C, or D? And if you are just joining, welcome to Ollie's Anatomy and Physiology Practice Review live streams. Like I mentioned, we go live multiple times a week, at least 4. I try to go live every day. We live again on Monday at 3:30 p.m. Eastern Standard Time. But welcome in, everybody. I also have my anatomy and physiology notes on my website. That is linked in my TikTok bio, as well as my HESI and TEAS A&P study guide. And then all the replays of these live streams are on YouTube. I'm going to write it right here, but it's also linked in my TikTok bio. But number 36, bioavailability is going to refer to D. It is the amount of drug reaching your circulation. So it measures how much of the drug enters systemic circulation unchanged. How a drug is excreted, that's excretion. Liver metabolism is the first pass. Drug half-life is the time that it takes to reduce the drug by 50%. Number 37, a placebo is a what? A, B, C, or D? A placebo is a what? A, B, C, or D? Can I repeat what I said about the HESI study guide? So I have an anatomy and physiology HESI and TEAS study guide. It is available for you to get on my website. It's linked in my TikTok bio. Number 37, the answer is C. It's an inactive substance. Inactive substance. So it would mimic the drug, but it has no therapeutic effect. Have you ever heard of like the placebo effect, right? Where in some studies they give a group the actual drug, and then the other study they give the study a placebo, which means it's just like a sugar pill or something, or just like a fluid pill. But number 38, half-life of a drug refers to what? We just went over this, so hopefully you were paying attention. But the half-life of a drug, it's kind of in the name. If you think of half, 50-50, right? So it is the time to reduce concentration by 50%. This is going to determine what this does. The importance of a half-life, in a sense, is what is going to determine the dosing intervals. Number 39, the abbreviation PO means what? A, B, C, or D? Also, if you were interested in getting the questions, all you have to do is join the community here on TikTok. I'm going to put a little notification up for it. Once you join, you will get the blank test with the answer key at the end after every single live stream. Like I mentioned, I try to go live every day. I go live at least 4 times a week, so you would be getting 4 practice tests a week, so 16 a month. But number 39, the answer is A. It is by mouth. It basically, this word, if you know your Latin, it's peros. I don't really know how to pronounce some Latin sometimes, but peros means by mouth in Latin. So that's why PO means by mouth. After meals would be PC. Before bed would be HS. Every other day is QOD. Number 40. Which class of drugs end in OLOL? OLOL. Almost sounds like LOL. In a sense. A, B, C, or D. What do you guys think for this one? Welcome in, everybody. Welcome if you're just joining. It's nice to meet you all. I'm Ollie, by the way, if you're new here. I go live multiple times a week covering A&P and other topics that you guys do request. Number 40, the answer is C. It is a beta blocker. We went over this earlier with ACE inhibitors. These refer like lisinopril. Diuretics, they can have some various endings sometimes. Can be some like furosemide. NSAIDs are non-steroidal anti-inflammatory drugs. It's like kind of what you'd see like over the counter. Oh, dang it. I keep explaining the next answer choices. We're going to move on to the next down here. Again, you can rewatch on YouTube. It's linked in my TikTok bio if you want to see the replay. 41, NSAID stands for B. It is non-steroidal anti-inflammatory drug. I had the wrong thing. That's what that stands for. Idiosyncratic reaction refers to what? A, B, C, or D? What does this refer to? A, B, C, or D for this one? Farragut, this would stop your live popped up. Nurse midwife in the making. That's awesome, Farragut. I'm glad you're here as well. I'm happy you're joining us. I appreciate everybody that's joining us too as well. These live streams are my absolute favorite thing in the world to do. I look forward to doing them every day. So any you just being here, you answering questions, liking and following and sharing, just anything, it just means the world to me. I love doing this. It's truly one of my favorite things to do. I just got my master's degree in molecular medicine in November, and I'm going to be applying for a PhD, and I definitely want to be a fantastic professor one day, teaching-wise, and definitely want to use this as a way to prepare. The answer is A. It is an unpredictable adverse reaction, so this is unusual, not necessarily dose-dependent. Allergic reaction is immune-mediated. Expected side effect, obviously, this is what is predictable. A toxic overdose is dose-related. Number 43, Teratrotin is a drug that what? A, B, C, or D? A, B, C, or D? A, B, C, or D? How do you request these study questions? Like I just mentioned, here, I'll put it up here in just a moment. But you join our community here on TikTok. This is our community that we have here. You just hit this button that I just popped up, follow the prompts there, and once you join, send me a message, and you will get the blank test with the answer key after every live. I go live at least 4 times a week, so you get 4 a week, 4 practice tests a week, 16 a month. But I try to go live more times a week as well. Starting nursing school in the fall, Blazing Queen. That's awesome. Congratulations. Good luck. This fall, we'll be here going live in the fall as well. Number 43, the answer is A. It harms a developing fetus. So essentially, this is a drug that would cause birth defects. Carcinogenic would be cancer-causing, causes addiction. That would be habit-forming. Damages the kidney would be nephrotoxic. Tachyphylaxis is going to refer to what? What does this mean? A, B, C, or D for this one? A, B, C, or D for number 44. We're on number 44 now if you're following along. Welcome, welcome. I was about to ask if you wanted to become a professor. Congratulations on your success. Thank you so much. Yeah, no, I definitely want to. It's definitely something I want to do. I love research as well and whatnot, but I do love teaching. I've been tutoring for 5 years, and I do absolutely love it. But number 44, the answer is C. It is a rapid tolerance of a drug. So this is going to be a decreased response after repeated doses. Increased drug sensitivity would refer to hypersensitivity. Allergic reaction is, again, it is mediated by your immunity. Drug buildup in the liver would be accumulation. Remember, so rapid tolerance, tachy means fast. Phylaxis is going to be tolerance for a drug. Number 45, what is a black box warning? A, B, C, or D for this one? What is a black box warning? A, B, C, or D? A, B, C, or D? I'm impressed with how much I know with no medical background. That's perfect. No, that's definitely a good thing. It's a good thing to know this information. Yeah, subscribe. Thank you, Carolyn. Thank you for subbing. Please send me a DM so I can get you the questions. Or send me an email. For whatever reason, if the DM isn't really working, send me an email. It's linked to my email is linked in my TikTok bio as well. Number 45. The answer is B. This is a serious safety warning from the FDA. Indicates that there would be a life-threatening risk. OTC labeling. That's not black. Expired medication labeled differently. Controlled substance mark. That's the schedule classification. So you have like your schedule 1, 2, 3, 4, 5. Number 46. Parenteral administration excludes what? A, B, C, or D? A, B, C, or D. What do you guys think for this one? Think about which one is. If you look at these, which one is different? I'm an ENT in paramedic school and answering all these right. That's awesome. That's awesome. You're probably a fantastic ENT then. That's awesome that you're in paramedic school as well. Good luck in paramedic school. Number 46, the answer is D. It is oral. So this is going to exclude oral. So this means it's non-oral. It is an injectable. Oops. All of these intravenous, subcutaneous, intramuscular are all injectables. Number 45, a synergistic effect means what? A, B, C, or D? And as we move on to the next page here, just want to introduce myself again. Hello, welcome everybody that's just joining us. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. This is where we're going to make anatomy and physiology and other topics like pharmacology, medical terminology, biology, chemistry, microbiome, all make sense for you. If you've taken it in the past and whatnot, this is definitely a fantastic review. Or if you're not really in the health field and you just like learning about some new stuff, this is also fantastic as well. Do you have anything regarding the nervous system? Yes, I do have some questions on the nervous system. They're actually on YouTube. And then pretty much every single anatomy and physiology live stream has them as well. How do you get the questions? You join our community here on TikTok. It's down in the bottom here. I just put it up. Once you join, send me a message. You will get the blank test and the answer key after every single live stream. Thank you, Debbie, for the gift. Thank you so much for the gifts, guys. Thank you so much. Number 47, the answer is B. Two drugs enhance each other's effects. So synergistic means it works together with something. It's a combined effects. The combined effect is greater than the sum of the individual effects. So two drug effects are better than one drug effect. It's a good way to remember that. Number 48, what does QD mean in terms of our drug orders? A, B, C, or D? You just put A, B, C, or D down in the comments. We're at 41,000 likes, guys. Thank you guys so much. These questions are to review for medical terminology, for pharmacology, and anatomy and physiology. We did anatomy and physiology for the first 25 questions, and then pharmacology the last 25 questions. A lot of students have anatomy, A&P, and pharm coming up in the fall, and I've been getting a lot of questions of how to prepare. This is how you prepare, in my opinion. I think getting your terminology down is the best way to get you very much ahead. We have 50 questions here today. We're on the last couple here, so power through these. Number 48, the answer is C. It is once daily. 4 times a day. It's going to be QID. Every other day is QOD, and as needed is PRN. Number 49, topical drug application means what? A, B, C, or D? Topical drug application means what? A, B, C, or D? What do you guys think for this one? A, B, C, or D? And then I will say hello to you guys as well after the live. I'm just setting up I only have my one stand today, so we'll have a little awkward transition time, but we'll get there in a moment. But number 49, topical is going to refer to B. It is applied to the surface. Applied to the surface. That includes creams, ointments, lotions, and whatnot. I always thought of topical. I thought of it 2 ways to remember topical, meaning applied to a surface. Topical, you put it on top of your body. The other thing I always thought about is topical sounds like, tropical. And tropical, I'm thinking of like sun and sunburns, and you apply like sunscreen to you, like the lotion or whatever, or the cream to your body. That's how I kind of remembered that one. A very random way. But number 50, anticoagulants are used to what? A, B, C, or D? A, B, C, or D? Anticoagulants are for what? A, B, C, or D? Can you say an example of a midterm exam for anatomy and physiology? I have some of those on my YouTube. We've gone over those in the past. They're questions that I've made. Number 50, last question here, everybody. The answer is D, is to prevent blood clotting. Anti means against. Coagulant means clotting. So against clotting, that's drugs like warfarin or heparin. All right, everybody, thanks. That's all the questions I had for today, everybody. Thank you all so much for being here. I appreciate you all being here on a Saturday. Happy Saturday. I hope you guys have a fantastic weekend. I'll be live again on Monday at 3:30 p.m. Eastern Standard Time. It'll also be on my profile. So if you go to my profile, it'll say like live event scheduled, or you can hit the notification bell. It'll tell you when I go live as well. If you want the questions and the answers, I missed most reviews. They'll be on YouTube afterwards. If you want the questions, here it is. You just join our community. I just put up the notification for it. Once you join, send me a message, and then I will send you the test. It's basically going to be the blank test with the answer key at the end. You'll get that after every live stream. I go live 4 times a week at least. So we get 4 a week and 16 a month. I try to go live more than that, though, so hopefully, ideally, and most likely, you will be getting more than that. But thank you guys so much for being here. I'm going to flip the camera around here and say hello. Give me 1 second. I'm going to have my little awkward transition time. Give me 1 moment, so sorry. But hello, thank you guys for being here. I'm going to flip this around. Give me a moment. Hey, everybody. Hi. Sorry, my hair's a little messed up today. Hello, everybody. Hello. I'm Ollie. I am the guy that has been yapping to you for the last hour for medical terminology and anatomy and physiology. Thank you all so much for being here. Hello, how's everyone doing? Hi, Ollie. Hi, everybody. If I look over this way, it's because I have my laptop up with the question, with your comments and stuff. So if I'm looking over here, that's why, because it goes so fast on the screen sometimes. Thank you guys so much for being here. Retaking AMP2 in the fall. We'll be going live in the fall and everything like that as well. Thank you guys so much for being here. You drinking Olipop. Great flavor. I know. Yeah. Hey, Lauren. How you doing? I know. Actually, I think if you weren't here yesterday, I was mentioning I actually don't like the drink Olipop. Thank you, though, for the rose. I am just like, yeah, not a big fan of Olipop for some reason, which is ironic. A lot of people always buy me Olipops. They're like, oh, I thought of you and stuff. And it's like, thank you. I appreciate that. Do I ever cover pathology too? Yes, occasionally, yes, we do cover some pathology as well. But welcome, everybody. Thank you guys so much for being here. I'm Ollie. I've been tutoring anatomy and physiology for 5 years now. I just got my master's degree in molecular medicine, and I've been applying PhD programs. And then I was also a pharmacist tech for 4.5 years. And I do love teaching. I love being here. I love doing these live streams. That's what we do here. What exam were you preparing for? Not necessarily preparing for an exam. Really just reviewing. I've been getting messages every day. A lot of people are starting A&P in the fall, starting pharmacology in the fall. I want to apply for a PhD as well. That's awesome. And I've been getting a lot of questions of how to prepare for those things. And for the most part, how to prepare necessarily depends on the level of your class, kind of what your professor is going to go more in depth on. But the best way to prepare is really hammering in the terminology. If you know the terminology, it really gives away a lot if you understand the terminology. You can answer a lot of questions just knowing medical terminology very well. I took medical terminology at the same time that I took anatomy and physiology, and it was definitely a saving grace a lot of times. Thank you so much for the subscription officially, Sean. Please send me a message so I can get you the questions. Like I mentioned, if you want the questions, you just join the community here on TikTok. Pin it up here again in just a moment. Thank you all so much for being here again. Have a great weekend. Hopefully we'll see you Monday. I just started a rad tech program that's awesome. I'm currently a CE PhD going back to school for sonography. That's awesome. Send you a message, Jay. Perfect. Thank you, Carolyn. Thank you, guys. Yeah, if you saw, please send me a message. You need the questions too. Let me put this back up. It should come up. Yes, there. If you want the questions, you join this. Join this. It's our community here on TikTok. Once you join, you just you message me. Let me know you joined. You get the questions after every live stream that I do as the blank one, and then it has the answer key at the end. I've joined. Awesome. Send me a message. Yes, send a message. Glad to be here. Glad you're here too. Thank you again. Any support in the live streams means the world to me. They're my favorite thing to do. I look forward to them every single day. So I do appreciate you all being here. Can you please study guide? The study guide's on my website. That is linked to my TikTok bio. Just go to my profile and then go to the link in my bio. It'll be medzeg.com. It'll be right on there. Then you can go through it. You just go to shop or whatever it is. It should be the drop-down menu, or you can scroll down some. But it should be the top right corner, drop-down menu. Thank you, Renee Kobe, for the subscription. Please send me a message so you can get the questions as well. Thank you guys so much. Have a great weekend. At least thank you guys. You guys also have a great weekend. I look forward to seeing you either on Monday or in a future live. But thank you guys so much for being here. I love you guys. You guys are awesome. Monday, so how this typically works. Monday, we normally go over HESI and TEAS, AMP1 stuff. Tuesday is AMP2 HESI and Ts, and then the rest of the week and the other lives are pretty much by most popular requests for things, so I try to include questions from everybody that's been asking. Oh, thank you, Keisha, for the sub. Thank you so much. Please send me a message. I'll get you these questions. Thank you so much. You guys are awesome. I didn't leave my email in my note. That's fine. No, I'll send you a message. Also, officially shoddy. Just if you want, I have my email in my TikTok bio. If you want to send me an email, you can do that as well. Just put your username in there and whatnot. Do I do any respiratory? Yes, I do. I do respiratory. We do those on Tuesdays when we do NP2. And I also have some respiratory specific questions that we have done in the past. Those are on YouTube. Thank you, Keisha Cox, for the subscription. Thank you so much. Please send me a message. We will get you these questions. Thank you guys so much. Awesome. I appreciate it. You guys are absolutely fantastic. But also, while I'm here and have you guys, if there's any questions here, I'm happy to stick around and answer. Like I mentioned, those are how you get the questions if you're interested. But also, I also have all my anatomy and physiology notes whenever I was an AMP. I got 100% on my final exam. I got an A in the class and whatnot. These are all available on my TikTok bio. That is linked in my TikTok bio. And I have an anatomy and physiology study guide for the HESI and Ts for anatomy and physiology. It has like table of contents here. You can see all the systems. I put some like study tips in here as well. It's just kind of like how I think, some study tips that I think that you should use. Thank you guys so much for the follows as well. I think we're like almost at 100,000 followers, which is insane to me. Like I would have never have imagined this is really where it would have ever have gone. It's linked in my TikTok bio. Again, if you have any concerns, just send me an email as well. The study guide. Yep. It's in my TikTok bio. It should be like one of the first things that comes up, I think, if you go to the shop. Any other questions here? Hopefully no tariff. No, it's digital, so no, you're good. There's no tariff. It's digital, so. Thank you so much for the follows as well. Any other questions? That's funny. Made me laugh. But it's a serious thing. That's a serious thing, though. But good question. No one's ever asked that to me before. Any other quick questions, though, while I am here? I am going to get going here. I do have to get going. But any other questions while I have you guys here? I'm happy to answer just any quick questions. Please send me some topic requests for live streams as well. If there's anything that you are having trouble with, I'm happily. Just join the live stream. Please tell me what you do. Yeah, absolutely. Hi. Nice to meet you, Susie. I'm Ollie. These are the Anatomy and Physiology Practice Review live streams. We do practice questions for A&P and other topics like pharmacology, biology, chemistry, and whatnot. Essentially, this is a review to help it finally make sense for you as well. Or if you've taken these in the past and you don't really remember, what time do I usually go live around? It kind of depends, but normally it's around 3:30 p.m. Eastern Standard Time. If you go to my TikTok profile, it'll say like live event scheduled, it'll give you the time that it should give you your time zone. But yeah, we do practice questions here, explanations, why answers are right, why answers are wrong, trying to differentiate, trying to go over what people are struggling with the most. Essentially, perfect, thanks. No problem, yeah, no, absolutely, no problem. Any other quick questions here? We almost ended live at 50,000 likes today. That's insane. That is insane, guys. I appreciate all the support. Am I on YouTube? Also, yes, that is linked in my TikTok bio. I post every replay of the lives on TikTok. Thank you guys so much for being here. I absolutely love doing these live streams for anatomy and physiology and helping you guys understand it better. I get messages every day that these live streams have helped people pass their classes, their HESI and Ts, other exams that have it on there as well. It just means the absolute world to me that this is helping people, and I love doing this. And yeah, it's so much fun. Truly it is. But thank you guys so much for being here today. Any other comments? That's going to be it for me today, guys. Thank you guys so much for being here. Thanks for following. Thanks for liking the live. We just hit 50,000. Let's go, guys. You guys are awesome. Thank you, guys. Hopefully I'll see you on Monday. Going to hope for NP school. That's awesome. Any other quick questions here before I get going? But if not, that's all I have for you today, guys. I will hopefully see you guys on Monday. Thanks again, guys. Have a fantastic weekend. Love you guys. Have a great rest of your day.